Now, as we're working to vaccinate Albertans and communities all across the province with at least 70% having 2 doses as our minimum goal, the UCP government has decided to even stop tracking the virus. Albertans who test positive will no longer be required to isolate, and this puts others at risk, most notably young people who don't even have access to the preventative vaccine that could help save their lives.
Dr. Hinshaw and I both have said that we expect to see an increase in cases in the fall based on seasonality, but that will likely be concurrent with an increase in flu and cold cases as well. But I am confident, we are confident, obviously, that the powerful protective effect of the vaccines is a complete game changer. We now have 2/3 of Albertans fully vaccinated and over 3/4 who have received at least their first dose.
A full public inquiry is necessary because it allows Albertans to understand what happened over the course of this pandemic and to plan for the future so we don't make the same deadly decisions again when we face another pandemic or another public emergency.
So important. There's been some, I think, let me just be charitable and say inaccurate information that has about the impact of COVID on kids. It's important to recall that in Alberta, over the 17 months of the disease here, we have not recorded a single COVID-related death for any Albertan under the age of 20. And the vaccine coverage just reduces the chances of children becoming sick or experiencing severe symptoms radically from where we were 6 and 12 months ago.
But it is clear that Albertans can no longer trust their own government to keep them safe. In fact, I believe it's fair to say that over the last 17 months, Albertans have seen Jason Kenney and the UCP government repeatedly undermine public health measures and mislead the public on matters related to public health. The Premier himself has called COVID-19 the flu, and he said that it's only a threat to the elderly or those who are immunocompromised. His MLAs have publicly undermined life-saving health restrictions, and some have even questioned the science of vaccines. And his UCP government's unwillingness to act in response to the second and third waves led to restrictions being implemented far too late.